The most important part is actually, the intellectual curiosity and being able to look at new areas and new topics every day.
Hi sir, how was your experience today at GIM?
Very good. I think a lot of fresh topics, a lot of active discussion, good set of panelists, healthy discussion. So it was a lot of fun.
So about your professional journey from your days at IIT and then to leading teams at ITC and now transitioning into consulting, what are the key experiences that you've had that you think have influenced you becoming a partner at Bain Company now?
For me, the most important part is actually, the intellectual curiosity and being able to look at new areas and new topics every day. I've always said this, that certain people commit to certain things. If you don't know what you want to do, then you should do consulting. So that has helped me. I get to see new problems every day, and also the other aspect is working in teams. So the element of the teamwork and intellectual curiosity together keeps me going at Bain for so many years now.
So, sir, about the healthcare trends in general, what trends do you think right now are the trends that will shape healthcare domain in the future?
I think definitely the technology adoption in the industry is, a very important element. I think there is a lot more to be done. I think disruptive topics like AI, which we were talking about, are going to shape the industry in a big way. I think the other element for a country like India is about creating access. So we obviously been able to solve a lot of the healthcare issues in the tier 1 cities. But how do you serve tier 2, tier 3 in a sustainable manner is another element which will be important to kind of go about in the future. I think these are two, and then third, I think, is just the payer model. Globally, if you see a country like Australia, I think 80% of the industry profit used to be with providers. Today, only 30% of the industry profit is with providers, 70% is with payers. So how the payer-provider dynamic evolves in the country with universal healthcare coming in, Ayushman Bharat coming in, I think these are something the industry will need to adopt and adapt to in a meaningful way.
So what advice would you have for MBA students who would like to excel in this field?
I think the most important part which you need to realize is, this is a mission-driven business. And a mission-driven business means you are in this business to basically make sure your patients have the best outcomes. I think that needs to be the underlying sentiment for anybody who wants to work in this space, and then everything else will follow. Very often, as you get into business in your initial few years, you'll talk about the numbers, you'll talk about performance, you'll talk about, how much money the hospital is making. I think those are all important discussions, but the first and foremost thing which you need to do as a healthcare professional is to making sure you're moving the outcome ahead, and that you should not lose sight of. That is, I think, my most important advice to anybody who's looking to embark on the healthcare journey.
Thank you so much, sir. Thank you for your insights.